Good afternoon, everybody. Today, I'm going to briefly describe the research program at Agriculture and Agri-Food Canada on the development of delivery technology for antibiotic alternatives for animal uses. In food animal productions, antibiotics have been used as growth promoters for many years. However, it is believed that such uses have contributed to the development of antibiotic resistance of some pathogens. Therefore, such uses have been restricted for many countries. However, withdrawal of the AGP has compromised the production efficiency and increased outbreak of certain diseases, such as necrotic enteritis in poultry. Therefore, there is urgent demand for the industry to find alternatives. A large body of research have been carried out to meet this demand. The proposed alternatives include, for example, vaccine, pre- and probiotics, various natural antimicrobials, and bacteriophages. One of the critical steps for the success of these products being adopted by the industry is how to effectively deliver them to the animals. Needless to say, delivery of these products in feed or with drinking water is the most convenient ways. However, there are some challenges doing so. Take probiotics and phages as examples. In order to be effective, sufficient concentration of viable phages or probiotics need to be delivered into the action site, which, depending on the target pathogens, can be different regions of small or large intestines. There are a few challenges for delivering them in feed to achieve this. Many adverse factors could lead to the loss of survival of these microorganisms, such as heat and pressure during feed pelleting and during transition through the GI tract, stomach acid, and the digestive enzyme could also do the job. Another example I would like to mention is essential oils. Numerous studies have shown some essential oils can selectively kill bacterial pathogens, but not affect the beneficial bacteria that are probiotics. However, when tested in animals, this activity was not often observed. Our study and a number of other research groups have demonstrated that without proper protection, most essential oil would be absorbed before they reach intestines, where most bacteria reside and grow. This could be accounted for some failures of these products in application. Similarly, without protection, these highly volatile substances will most lost during feed pellet. In addition, these antibiotic alternatives are usually produced in liquid medium. However, for feed applications, it is desirable to have a solid form that can be stored at temperature, easily transported, and used during the feeding. And this is where our study goes in. We propose to use microencapsulation technology to address these issues. So, the objective of our research is to develop microencapsulation technologies that are effective, affordable, and convenient for use. In AAFC Guelph Research Center, we have a wide range of instruments as shown here, that allow us to carry out studies to develop encapsulation technologies for selected antibiotic alternatives. And this is a fluidizer to make emulsions, and these are encapsulated to make microcapsules, and these are granulator to reduce the particle size of powders, and this is a spray dryer to spray dry powder to make powders. And this pelletizer actually is used either for coating or increase the particle size. And this is a fluid bed coat to allow us to do secondary coating on powders. And this is a particle sizer, allow us to measure the emulsion particle size. At our Saint-Hyacinthe Research Center, Quebec, we have a pellet plant. This is a corner of the pellet plant, and which allow us to scale up our developed technology. And this is a spray dryer we used to make some of our encapsulated products. Next, let me give you a few examples for the past years. First, I would like to talk about microencapsulation of probiotics. As you know, currently, probiotic cultures are primarily freeze-dried before they are made to other dosage form. Freeze drying are time-consuming, expensive, and also has limitation on production capacity. To address this issue, we have developed an encapsulation technology that enabled spray drying being used for drying probiotic cultures. Using spray drying instead of freeze drying can significantly reduce the production cost and increase production capacity. Even better, the resulting probiotic product can significantly increase the survival of probiotics during feed pelleting and during transition through the GI tract. This technology has been patented, and the patent is approved, and we are currently, and also the technology is scaled up at the AFC's pellet plant. A Canadian company is in the process of testing the technology for commercial applications. Second example, I would like to talk about the encapsulation of essential oils. In the past 10 years or so, we have developed several encapsulated essential oil products. These products have been tested in vitro and in well-controlled animal trials, in which they have demonstrated efficacy in improving gut microbiota and enhanced gut health, and reducing bird mortality as well. One of the products has recently been tested in commercial broiler farm, where it was proved being able to reduce or preventing outbreak of necrotic enteritis and significantly reduced mortality. We are now working with a Canadian company, Galvin's Feed Consulting, for the commercialization of this product. Another ongoing project is about the encapsulation of sodium metabisulfite for the purpose of detoxifying vomitoxin dung. As you know, vomitoxin dung may negatively affect animal growth. As a strong reducing agent, sodium metabisulfite can degrade dung quickly. However, SMBS is not stable in stomach, where it decomposes quickly, thus loss its detoxifying function. So we want to protect the SMBS from the deactivation in stomach. Because SMBS is highly water soluble and prone to oxidation, it cannot be encapsulated in aqueous medium as we did with essential oils and probiotics. Therefore, we have developed an encapsulation technology using fatty acid of various melting point. For more information on this project, please visit the poster by Dr. Tracy Gore in the poster section. Lastly, please allow me to proudly mention that in last week, this research has received a prestigious award from AAFC for the prize for outstanding achievement in science, in recognizing the scientific contribution of this team to the agriculture sector. These are the proud team members.
Thanks, Chief, for your presentation. We'll just wait a second until your video is up. I don't know about everyone else. We're all in different time zones, but I haven't had my lunch yet. My stomach is growling, so I would take anything encapsulated right now.
It said you cannot start your video because the host has stopped it. So you have to allow.
Okay, well, I can hear your voice, so why don't we just go ahead?
Sure.
There's 43 people participating in this session, and we have one question that's popped up, and it's after formulated to dry spray, do lactobacillus are they still able to colonize the chicken gut and function?
Yes, we have actually tested not in chicken, but in pigs. Yes, it will be able to colonize.
And then I have a general question. So in terms of what's the current storage stability or shelf life for all these microencapsulated probiotics right now? I'm just curious to know what it currently is and then what the ideal goal is. I mean, if I'm working at a mill, I want as long a shelf life as possible, but what right now are you working with? And then what's your goal in terms of storage stability?
Well, in terms the storage stability is really depend on the species, what you work on, and also at what temperature is critical. I think for now we are on the process for optimize this formula. And at the moment, if we start at refrigerated like 4 degrees, we can store months and months, but in room temperature, it tends a little bit difficult. We're still working on that.
Okay, and another question's popped up in the box. It says, how much material can you add in these capsules?
Well, are we talking about essential oil or phage or probiotics? It depends what you want to add.
Sure, if you can give us maybe an indication for all of them.
Okay, for essential oils, the highest concentrations we have been getting is around 30% of the essential oil content. And the probiotics, we have 10 to the 9th.
And I guess there was a follow-up.
In the powder per gram. Yeah.
Okay, and then what about, it says in plant material, how much material can you add in these capsules? And then there's a follow-up that says plant material.
When we say capsules, it's not in like what we're talking about in the pharmaceutical capsules. And this actually is just powders.
Okay.
So we will say CFU per gram. We're not measure per capsules, per particle size particles.
Well, thanks for clarifying.